Okay. Hi, everyone. I am joined here by Anya Volodina, who is an owner of a Pilates studio, and she actually owns Pilates Buddies and is also a registered nurse. So she was in the healthcare field for over 10 years and then gravitated towards more integrative therapies. So reflexology was one, aromatherapy. She also does meditation and yoga, and now gravitating towards this Pilates, which is very fascinating. And we're sitting with Anya today to talk a little bit about pre and postnatal pelvic floor health and how that might look different for somebody who's going through fertility versus somebody who's in pregnancy and postpartum. And so Anya, welcome. I'm so excited that you're here with us. And I know you just have so much knowledge to share around this topic. And I think that a lot of women neglect their pelvic floors. So I really want to get into this. Can you start by telling us a little bit more about yourself and how you got into this business?
Sure. So as you mentioned, I'm a registered nurse. I didn't practice very long after I graduated from university. But when I did practice for the 6 months, I actually was in labor and delivery. And I think I take this very close to heart because to me, if I ever were to go back to practicing nursing, that's the only field that I would go back to, because really when the child is born, it's like a miracle of life. And it's very, very precious to see and be part of women's process of delivering the baby from the inside into the outside.
I know,
So, so I really, really love that field. I didn't stay in the hospital for a very long time. I transitioned then into pharmaceutical industry, and I was in pharmaceutical industry for 10 years. And it was nice to be working there, but it didn't really speak to my heart. So I decided to go more into more of a not conventional, more of a holistic approaches to health. Myself, I was pregnant 6 times, but I actually have only 2 children. And I like to help women in any possible way I could. And I think working with I specialize in pelvic floor health. And I think working with pelvic floor before, during, and after delivery is very, very important.
Absolutely.
It's the muscles. I have clients who come to me who have never had kids, and they start saying that after those specific exercises for pelvic floor, they feel the difference in many aspects. And that starts with just enhances the sexual experience during the intercourse, right? They feel their body a lot more. They feel the ovulation. Actually, they start become very connected into when they ovulate and when they are about to have a period, and etc. So amazing. The connection is very much aligned into the breath and the pelvic floor muscles. So what happens, just a little bit of anatomy. So your how breath is connected. The breath is regulated by the muscles that's called the diaphragm, which sits right here, right? The diaphragm then connects to the pelvic floor, which it connects to the transversive abdominals, and transversive abdominals connects to the pelvic floor, which sits right there in the creases of your hips. So what the diaphragm muscle does when you inhale, so you fill up your lungs with air, which means the diaphragm kind of lowering down. So when you inhale, filling up the lungs with air, the diaphragm pushes down in the pelvic floor. And when you exhale, the diaphragm pushes the air out, which means it's lifting. And with the diaphragm, the pelvic floor lifts as well.
Right.
So that's the connection there. And once women, I think I can teach you all the exercises there are. There's like a lot of them. But what's very important to understand is that connection between the pelvic floor muscle and the diaphragm of the inhalation and exhalation. A lot of the times women ask, what are pelvic floor muscles. So it's like a hammock that sits right from the hip joints and go out into your sacrum, kind of hugs you and cradles you right there. I don't have, unfortunately, a little mannequin to show you that on, but it cradles you like a hammock right there. So all the organs that are sitting there, so your bladder, your uterus, your fallopian tubes, your cervix, even in like lower intestines. For some of us, it could be even kidneys, depending how low the kidneys sit. So all those organs are supported by the pelvic floor muscles.
Yes.
Which means it's very important to acknowledge and feel how they work, again, before you get pregnant, during pregnancy, and after. In my opinion, working with pelvic floor muscles after pregnancy should be almost like a standard for everybody.
Okay. So can you, that kind of leads into my next question. So in your opinion, how does the pelvic floor change physically, and how would exercises change for that woman depending on the state of motherhood she's in? So if it's like fertility versus pregnancy versus postpartum, can you speak to that a little bit?
Sure. So I guess number one recognition, or number one thing that every woman needs to understand, is the tightness of the pelvic floor muscle, because it could be too loose or too tight.
Right.
But the funny part is that symptoms are the same.
Okay.
So you could be running to for like trying to get a bus or trying to get a cab, running to get it, right? And you could kind of pee your pants a little bit. For some of us, it could be jumping on a trampoline and again peeing a little bit. For some of us, it could be sitting on the toilet thinking that we're done peeing. We get up, we change the position of the muscles, and then we realize that we're still full. So we go back on the toilet and we need to continue peeing. So there's all those different, some of us, it could be just dancing and moving around in the everyday life. So we could experience all those same symptoms, but the state of the pelvic floor muscles could be different. It could be too loose or too tight.
Okay.
If it's too tight, for example, it's very, the delivery will be a little bit harder. Because so you want to make sure that you connect your breath to the exercises and to the pelvic floor before conceiving, so that you understand how you can relax those muscles and allow yourself to go through the delivery with ease. It's just as important to practice it during pregnancy, because again, you want to make sure that you contract enough to hold in the baby. And for some of us, it could be an issue of the muscles of the cervix are not tight enough to hold with the baby. It's an issue that happens all the time, but you can actually fix it not by putting a suture in, right? But by exercising.
Right.
I've lost a child when I was 6 months pregnant, and I can tell you that this is possible, that understanding how your pelvic floor muscles function, actually you can go very easily the next time when you're pregnant, like if something like this happens, right, without putting into a medical intervention, like with the I opt out for not putting a suture in, for example, and everything was fine. My son was born 8.5 pounds.
Wow.
So it's the muscles held him there enough, so it worked.
Yes. Do you think
and then obviously after the delivery, we want to
Oh, no, go ahead. I'll ask my question.
Okay. And then after the delivery, finishing up on that question, again, it's very important to be able to sustain the normal health of your pelvic floor muscles, because everything has been loosened up there. And we want to make sure that we tighten it back. We feel comfortable in everyday life. We don't have to wear panty liners and etc. So all those things, I think, come into play, and very important for women before, during, and after pregnancy.
Okay. So it's very much, I thank you so much for sharing kind of your personal journey with that. But it does sound like everybody's really individualized, and it, needs to be individually assessed to see what muscles are tight, what muscles are not tight. So it doesn't necessarily mean that one exercise is, works for everybody.
Right.
So is there any exercises then that should be avoided? For example, if, muscles are too tight or anything like that, is there anything that you would recommend maybe not doing?
A lot of conventional therapists and doctors, I think, would recommend that women do Kegel exercises.
Mm-hmm.
And I think Kegels should be taken with caution. Not that it's bad or good. It just it should be taken very cautiously. So we have
Okay.
two sphincters in our vagina and our anal sphincter.
Yes.
When you do Kegel, and if you're not attuned with your body, if you're not very much aware, if you just never practice exercising and you're just doing Kegels, most likely when you do this, you will contract both muscles, both sphincters, right?
Right.
So what it can create, if your muscles are too tight, it will make them tighter.
Right.
And another, like a long-term issue that could create, that you actually will start contracting the anal muscle, which as you know, our bowel is a muscle of its own. And if you're
Right.
prone to constipation, by contracting that muscle, you're not allowing yourself to release the bowel, like to empty the bowels when they need to be emptied. It's a long-term effect. It's obviously not going to happen overnight. Like if you did Kegels once, it doesn't mean that next time, like tomorrow, you're going to be constipated. Not at all.
Yeah.
But
I love that you said that, because so many pregnant women already have issues with constipation. Right. And I get so many patients myself who come in and say, oh, I'm doing all my Kegels and I've been doing them for weeks now. And I'm just like, no. Right. And so I'm so happy you touched on that, because like you said before, you want your muscles to be relaxed before you kind of go into labor so that your tissues can move, right, and have a faster labor. So I think that a lot of women make that mistake of doing their Kegels too early and then tightening everything up, and then it can make for like a longer labor, a more uncomfortable labor for them.
Yeah, no, totally. I totally support that. And then, again, it doesn't mean that Kegel, you cannot do Kegel, but if you do it the right way, then obviously it's a great exercise to do it.
Right, exactly. So what symptoms or signs should a woman look out for that might give her like an indication of, oh, I should see somebody for my pelvic floor, do some like Pilates or pelvic floor work?
Right. So what I touched on is that it's very important to understand whether the muscles are too tight or too loose. The program that I teach for pelvic floor, it actually works for both ways, whether the muscles are too tight or too loose. However, anytime the person comes in, I always say, at least go once to a pelvic floor physiotherapist to get an assessment, because they're qualified to actually feel the muscles inside of you and tell you exactly if it's too tight or too loose, because the approach would be different. So I think it's number one thing that's very important to recognize, that those muscles have to be checked. And even if you just go once, then the approach or the symptoms, you asked me about the symptoms that I think I alluded them a little bit before, could be very different. It could be constipation. It could be that you have to urinate frequently, too frequent. It could be that you wake up too often at nighttime to get up to the bathroom. It could be that you, again, sitting on the toilet, you think you were done, but then you get up, you shift the position of the pelvis, and all of a sudden you still have to empty your bladder, continue emptying your bladder. That's one of the symptoms. More obvious symptoms, that again, you can't jump on a trampoline or run somewhere, you start peeing your pants. But even if your muscles are too tight, you could still experience those symptoms. That's the funny part, is that the symptoms are the same. The kind of the reason is different.
Oh, that's amazing. That's incredible. And usually the more babies women have as well, that issue kind of can get worse too, right? If it's not corrected.
Right. Yeah. And many times women ask me, well, I had a C-section. Does that mean that I'm okay for pelvic floor? It doesn't matter. You've carried the child for 9 months inside of you. So there was pressure pressing on your pelvic floor from the inside, which means the muscles weakened a little bit, or maybe tightened, depending on what the situation is. So it's not about the vaginal delivery. yes, I have to say vaginal delivery plays a role in here, especially if you had a lot of lacerations and you had to put a lot of suture, you had to be sutured up, because you kind of creating then scar tissue in your muscles, right?
Yes.
So which affects again the function of the pelvic floor muscle.
Okay.
But it's could be, but it's not the only reason. There could be other, like again, because you've carried the baby for 9 months, that could also be a reason for you to have issues with pelvic floor.
Okay. Yeah, I never actually thought of it that way. That's a really good perspective. Like that's really good to learn. So how can women work with you? Like how can women find you and work with you, and what's the best way?
So the program that I teach, it's actually by Dr. Crawford, and if you guys are interested, you can look it up. It's a surgeon that's developed the program. He actually noticed that women repeatedly come back to him after hysterectomies to lift the pelvic floor organs back up. So let's say he does a surgery for them, and then he notices that in 2 years they come back again, and some women do it up to 7 times. So he's like, okay, something is not working. I'm fixing them, but then they keep coming back.
Okay.
So unless you fix your muscles, I mean, this is a worst case scenario, obviously, but unless you fix your muscles and you train your muscles to hold those organs inside, the issue will keep coming back. Okay. So if I may share, like myself, I do the program, like I don't do it every single day right now. I do it maybe every couple of months whenever I feel, okay, the muscles have weakened a little bit, I need to work on them again. It's 10 exercises that you can choose 2, 3, 4, however many you want, and you don't have to do all 10. The whole program takes about 20 minutes, 10 exercises. You start seeing the difference within, I would say, 2 to 4 weeks. You already see the difference. Okay. And for really fruitful results, 6 weeks is good to go. This is the first time you do it, and then every time you have to do a touch up. You don't have to go that long, because muscles, they have memory, right? Yes. So you kind of just remind them of what it feels like, and that's it. It's
so kind of like a maintenance type thing.
It's a maintenance type thing. I teach the workshops on this program, but again, there's lots of other practitioners out there too who it's as I said, it's called Pilates. So I can actually send you the link of exactly what it's called, so that you can put it in the comments, or I can add it to the comments.
Yeah, and I'll add your website and your Instagram handle and everything, so that people can follow you and be able to find you. And
no, it's a great program. It's really effective. The way he designed it, I think I was trying to get to this, is that he put together about 100 women, and he connected them to the monitors, where the monitors will measure which muscles they're using when they're engaging in specific exercises. And then he picked 10, the most effective exercises. Whether you think about pelvic floor muscles or not, you're still engaging them. So whether you're connecting to your breath or not connecting to your breath, you're still engaging those pelvic floor muscles. Obviously, engaging the breath and connecting to the breath enhances the results quicker. But the beauty of it, that you don't have to think about anything. You just do the exercises, and your pelvic floor muscles are working.
Right. Oh, that's amazing. Well, thank you so much, Anya, for joining us today and sharing all that wonderful knowledge with us. I think that as women, we really need to start looking into our pelvic health more. More and more we're seeing reproductive issues and, painful periods and all these things, which I think could also be corrected with some of the work that you do. And even pregnancy, like having the constipation and feeling very heavy in the pelvis. There's a lot of work that can be done there in preparation for labor and, of course, postpartum healing. So thank you so much. So everybody, if you want to find Anya, please take a look at the notes below, and you'll be able to follow her on Instagram, follow her on Facebook, and take a look at her website. All right. Thanks so much, Anya.
Thank you. Thank you, Jessica. This was awesome. Thank you for inviting me.